Hello, I'm Charmaline Ramento, and I'm here to discuss about my media project number two case study again. I'm going to start with the patient's history. The patient is a 20-year-old female who was admitted at the ER due to nausea, vomiting, and abdominal pain. Patient doesn't have a primary care doctor and has not been seen in the past 10 years due to lack of insurance. Patient is recently just got married and reports history of infertility. So, okay, urinalysis and radiography imaging was done and showed metabolic alkalosis um, with a pH of 7.7 and plasma bicarbonate concentration of 83 millimoles per liter, and gastric outlet obstruction from peptic ulcer, which are higher than normal. The normal pH is 7.4, and normal bicarbonate concentration is 22 to 32 millimole per liter. So this patient was diagnosed with gastric outlet obstruction from peptic ulcer. So what is peptic ulcer? So the digestive tract is usually coated with mucose layer that normally protects against acid. But if the amount of acid is increased or the amount of mucus is decreased, you could develop an ulcer. Um, Peptic ulcers occur when acid in the digestive tract eats away at inner surface of the stomach or small intestine. The acid can create a painful sore that may bleed. So peptic ulcers can block passage of food through the digestive tract, causing you to become full easily, causing you to become like doesn't have appetite, lost weight, and you'll have a swelling or inflammation or scarring. And for the case of this patient, the patient had a gastric outlet obstruction, which is a narrowing. So that can cause vomiting, which is one of the symptoms for this patient. The patient came in vomiting and abdominal pain. So prolonged vomiting causes loss of hydrochloric acid and produces an increase of bicarbonate in the plasma to compensate for the lost chloride and sodium. So this is how the pH increased. And this is what we call metabolic alkalosis. It's when our pH increase above 7.45, and for this patient, her pH was 7.7, and also it results to increase in plasma bicarbonate, and also the body compensates by suppressing breathing to hold carbon dioxide, and also the kidneys have two very important roles in maintaining acid-base balance. So they reabsorb bicarbonate in the urine, and so the urine leading to be alkaline. So can metabolic alkalosis affect fertility? So the patient reported history of infertility. So the answer is yes. Acid-base balance level can impact women's fertility. So, in a normal person, sperm must travel through the vagina and cervical canal before reaching the fallopian tubes to fertilize an egg. An imbalanced pH level in the cervix can damage the sperm, and the ideal pH should be about 3.8 and 4.5. But then if it's too high, the fertilization doesn't occur because the sperm get damaged, like what I said. So for this patient, they did surgery to repair the main cause, which is the gastric outlet obstruction secondary to peptic ulcer. And she was referred to a fertility doctor and primary care. That's it. Thank you.